And hi, everyone. Really great to see you all join today. Looking forward to the discussion that we'll have. And I guess I really wanted to just talk a little bit about the work that ILC has been doing over the last couple of years. For those who aren't aware, ILC has been sort of embarking on a large international project on looking at how we can prevent ill health in an aging world. And we started this a couple of years ago, and now we're working towards, how can we actually find solutions to making people healthier? And we realize there's lots of areas within society that can actually play a really important role in delivering prevention, and workplaces are no exception. What we've found through our research is really that, workplaces can help overcome several barriers to access, geographical. So, people don't have time or the access, language barriers, cultural barriers, institutional barriers. They can also help address wider issues such as poor health literacy. And we also know that workplaces can also deliver services in a number of different ways. So they can actually deliver specific services such as health checks or screenings, but they can also help individuals navigate healthcare systems, so through signposting, and they can also help educate individuals through various different campaigns. So there's lots of different ways in which the workplace can actually play a role in making people healthier and supporting people's health. And there's sort of, I guess, three examples that I wanted to bring your attention to, and hopefully that will give us a sense of, the role that workplace can play. And the first one is an intervention that was delivered in Nanjing, China. And this was for women over the age of 40 across various different work sites to improve breast cancer screening. So one of the biggest issues in that city and across the country actually was that women are unaware of the risk factors for breast cancer, and they're unaware of the fact that how they can prevent breast cancer through screening. So this intervention was interesting because it addressed a number of different issues. First, it developed sort of a educational workshop where individuals can learn about breast cancer, the risk factors, the symptoms, understand why prevention, early prevention is so important. It also enabled people to learn about the healthcare service, how navigating the healthcare service, how can they actually go and access various services, how can they get their breast cancer screening. They also allowed individuals, women, to go to appointments during working hours, and they also supported them financially by paying for their screening. Through this intervention, actually 75% of the women who had never had a breast cancer screening before said that they had a breast cancer screening because of this intervention. So it shows sort of the direct impact that this can have on individuals. Another example I wanted to draw attention to was an intervention in New York called Step On It. And this was aimed at taxi drivers. Who large demographic are South Asian, and they have a number of barriers to accessing healthcare, including a lack of insurance, language barriers, cultural barriers, and they're also at greater risk of developing cardiovascular disease. Through this intervention, it was a short intervention. I think it was about for 5 days. They ran a sort of mobile health clinic at an empty parking lot where taxi drivers could come and get various tests done. And what this enabled them to do was actually identify those who were at a very high risk of developing illness and then signpost them onto further testing and services. A great way to kind of catch and prevent illness. And then the final one is actually not delivered by the workplace, but I think it's an interesting way just to identify that, in certain workplaces, individuals are more prone to certain illnesses because due to the conditions in which they work. And this example is in the UK. It was called the CFIT program. It's still ongoing, and it's essentially a number of clinics across ports and quaysides across the UK delivering health services to fishermen. Now, they are at risk for a number of chronic and acute illnesses due to the conditions of their work, but also they're unable to access services because of the nature of their work. And there's also quite a pervasive culture around not going to healthcare because of the male-dominated environment that they work in. And again, here, various range of services delivered to fishermen, and they've seen huge increases in individuals not only getting tested and then referred on, but actually developing a ongoing relationship with a healthcare provider for the first time that they've never had. And I think it was about maybe a quarter of the people that they have seen so far have actually had, their teeth checked for the first time in over 5 years. So I think hopefully these kind of examples can give a bit of direction for our discussion today. But I'll just stop it there. And yeah, looking forward to hearing all of your comments.